Today we are going to talk about immunology and immune system, and this is Nyla Goldenberg, who is functional endocrinologist, and we are doing this 12-week Get Well program, which is in reality much longer than 12 weeks, but it's a lot of fun to just talk about different, what we call root causes. Today we're going to talk about immunity, what types of immunity we have, and what different problems associate with immune system, like immune deficiency, autoimmunity, allergy, and sensitivity. And so we are going to talk about immune system, and immune system is our body's way of preventing and limiting infections. And it's our body's way to discern what is ours and what is not ours. Our body needs to know what is belongs in it and what is not. And when it doesn't recognize what is not, that's when we may have problems. In reality, it's very complex. It consists of different cells, organs, protein, tissues, and all of that allows us to defend from bacteria, viruses, parasites, and more. Here you can see that we have white blood cells, leukocytes, that are a major part of immune system. There is a spleen and bone marrow and lymphatic system. Spleen and bone marrow produces white blood cells and helps white blood cells to what we call differentiate, which means they're going to learn about our surroundings and about our inner cells. And that's how our body will know who is our own and who is not. Then we have lymphatic system, which consists of channels and lymphatic nodes, as well as tonsil, adenoids, and appendix. They're all part of that lymphatic systems. They help our body kind of to get lymphatic fluid up from every part of the body and eventually get to central cistern chyli. You can see that, and that eventually gets into circulation. And we have as well thymus, which is very important for babies. And as we age, it degenerates, and we are not supposed to have much of thymus left as adults. But it's definitely a super important portion of the immune system during childhood. So we have different types of immunity. Innate, it's the first line of defense against pathogens, and it's skin or mucous membranes of the throat, of the guts, of the sinuses. All of that is our first line, and that helps us directly prevent the passing into our body. Then we have adaptive immune system that our body develops over time, and it's our body has a range of antibodies to different pathogens that help to develop immunological memory. This could be part of vaccination. People get vaccinated, then your body knows that you are supposed to attack whatever was in vaccine. Or if you've had certain conditions like measles or rubella, your body will create memory against those viruses and will keep you immunized against those for years to come. Some adaptive immune responses are short. For example, as we are learning with COVID, the immune response, immune body memory is relatively short. And that's why many people have COVID over and over. And COVID is part of coronaviruses. And coronaviruses are most commonly known as just common cold. And that's why many people develop the common cold frequently, because our adaptive immune system is not capable of keep memories against those pathogens for a long time. So, and then there is a passive immune system. It is an immune system that you can get from somebody else. For example, a baby gets it through mother, fetus gets it through mother, and it lasts for several weeks after the birth. And there are certain antibodies and immune responses that mother can pass through milk. Or you probably remember, again, with COVID, there was initially people who have had COVID, their serums were collected and infused into acutely sick people with the hopes that immunological responses, immunobodies or antibodies that were produced by people who have had COVID will help people who are actively sick right now to kind of eliminate that virus. So that's passive immunity. And what is one of the main parts of immunity is antigen. Antigen is technically a protein, and it could be any types of protein. It could be protein that we eat. It could be part of cell, part of virus, part of bacteria, part of cancer cells. Anything outside of our body could be antigen if it has some portion of protein and that our immune system can create a response against. So Mr. Antigen, there are all kinds of, a lot of them, and it usually gets into our body and meets T cell, which is lymphocytes, part of leukocytes. And specifically, T helper is very helpful, and it helps to introduce antigen to different other cells, including natural killer cell, which natural killer cell gets together with the antigen. If it's, let's say, imagine this is a virus or bacteria, and it starts attacking it, and it's able to eliminate the antigens. So we have different types of cells in lymphocytes. They're called B cells, and B cells, they're actually chemics. They are making immunoglobulins, and there are different versions of them, and we'll talk about them a little bit further. Those immunoglobulins, they are able to travel on their own, and the B cells, through help of T helper, will know what kind of antigens to create. I mean, what kind of immunoglobulins to create against the antigen. And because of that, this immunoglobulin will be able to kind of surround that antigen. It will get the help from complement system. And complement system is a series of proteins, enzymes that enable the attack against that Mr. Antigen. So this immunoglobulin complement system will technically eliminate our bacteria, virus, or whatever else. And there are other cells like macrophages. Again, frequently they work through antigens that macrophage specifically turns into phagocytes, phagocytes. And phagocytes loves to eat different viruses or bacteria. And as a result, it destroys it. For other parts of our bodies, antigen becomes equivalent to allergens. That usually happens when it connects to immunoglobulin E and mast cells. And mast cells are specific cells that have high amount of histamine. And when we have that histamine release, then people develop allergic reaction. It could be swelling, itching, and so on. And there is some degree of elimination, because when you have that extra swelling, extra nasal secretion or eye tearing, you kind of naturally starting to eliminate that antigen. But frequently it's associated with too much of inflammation and unpleasant symptoms. So this one is example of different immunoglobulins. We have immunoglobulin M, like Mary. It's usually occurs starting 5-6 days after acute infection and lasts for about 6 weeks. Meanwhile, IgG is immunoglobulin G, starts being created about 4, 5, 6 weeks after the infection, and it's for many cases it will last for long term, for many years, and it will provide you this long-term immunity or reactivity if it will be created against different food or things. IgA is mucosal immunity, for example, your sinuses, your guts. If we do stool analysis and see high IgA level, it usually indicates that there is some presence of bacteria, viruses, or yeast infections, fungi, or other things that can trigger this IgA production. IgE is allergic reaction, as we mentioned. And there is IgD, which is small amount, and they activate B cell, mast cell, and basophils. The half-life of immunoglobulins could be between 7 and 21 days, and that's why frequently we have elimination diet for 30 to 90 days to have at least 3 half-lives. And elimination diets, of course, are specifically to remove things that we could be reacting to. And that's how we can reduce immunological reactions, in a sense. So there are different conditions that could lead to immune deficiency. Some of them are people born with, for example, primary immune deficiency. Some of them are developed over time. For example, with age, we definitely become more susceptible to different infections, and our immune system is weaker. We do have as well certain conditions like HIV that specifically affects certain cells, and as a result cause immune deficiency. Not only that, but malnutrition or obesity, diabetes, high alcohol use, all of those will be associated with immune deficiency. Different treatment like chemotherapy, radiation therapy, those are definitely cause immune deficiency, and that's why people who are undergoing chemotherapy or radiation, they need to be protected and wear masks and so on. Many drugs that treat autoimmune conditions, they're definitely affecting immune system, and again, medications that are used for transplant patients. So
is that where my steroids come in?
Yes, steroids, a high dose of corticosteroids, of course, are associated with immune deficiency. But again, it's like U-shape. You don't want too little of steroids, you don't want too much, you want just right, like a Goldilocks. Yeah. The autoimmunity. Autoimmunity is a condition when your body is confused and starts attacking its own tissues. The Hashimoto disease and Graves' disease are antibodies that attack thyroid. And with Graves' disease, you can see, like in this patient's case, it attacks fat behind of the eyes, and it causes the protrusion of the eyes. With type 1 diabetes, immunity attacks specifically beta cells. And in lupus, for example, it attacks multiple organs, but usually it's connective tissue of kidneys, connective tissue of brain, joints, heart, and so on. That's why different autoimmune conditions could look differently. But the basics are very same. The body is confused. And if you imagine that your immune system is a guardian or police, here this police is completely goes haywire and starts attacking its own faculties. So there is always this immune balance between autoimmunity and cancer. If you have immune activation or immune tolerance, immune deficiency, and complex immune dysregulation that has different combined autoimmune disorders and cancer. Because technically cancer is, again, immune system disease, because it's where your own body is not able to recognize that there is cancer cells. There are cancer cells that don't belong in the body. And autoimmunity, when it recognizes too well, and it becomes confused and start thinking that our own body is foreign and tries to kill it. So the allergy is when your body reacts against common antigens and starts creating too much of IgE, immunoglobulin E's. And in these cases, as we talked, antigens now called allergens. And most common ones you've probably hear about: peanut allergy, dust allergy, fish, and so on. And the reactions, usually anaphylactic reactions that could be deadly if you don't have EpiPen. Angioedema, like in this poor person, I've actually saw a friend of mine, she had angioedema, and I remember how she would sit and suddenly her lips will start swelling up, exactly like in this case. And all of that's associated frequently with itching, runny nose, itchy eyes, hives, and so on. There are sensitivities, which is different from allergies. It's when immune system reacts in exaggerated, inappropriate way, but instead of creating IgE and producing the histamine reaction, they associate with IgG and IgM immunoglobulins. There is a lot more things are happening during that. And you can see there is triggering mechanisms will be food antigens or chemicals in different lectins and so on. And there will be sensitized T cells, the T helpers, and natural killers. There is involvement eosinophils, basophils, monocytes, neutrophils, and production of all kinds of chemicals, TNF, interferons, leukotrienes, histamines, amines, and prostaglandin, and so on. And as a result, these symptoms are very diverse. And one can say that even migraines, depression, ADD, epilepsy, urticaria, fibromyalgia, and so on this list can be part of intolerances. And we definitely know irritable bowel syndrome, for example. There is a celiac disease that technically is like allergy, but there is non-celiac gluten intolerance, which is actually more like intolerance. Clinically, they will feel exactly the same. People will have abdominal pain, diarrhea, bloating with eating gluten, but the antibodies that are found will be quite different. There are different testings that could be done for allergies and for sensitivities. There could be a blood test. There is skin testing for allergies specifically, where small needles introduce small amount of those allergens, and people have, I remember my son his whole back was punctured with different antigens, and some
Yeah.
of them showed up as big and red hives and were quite itchy because of allergic reaction. And that's how gold standard technically for allergy. But allergy is not always sensitivity. Sensitivity frequently happens a little bit later. Allergy is more immediate response within 24 hours. And the sensitivity frequently takes longer. It may take 2 to 3 days, up to 5 days. And that's why we usually suggest to keep track of food and our other encounters for several weeks before we can fully figure out what person could be allergic or sensitive to. And the elimination diet here is removing specific foods from your diet. And as we said, removing for between 4 weeks and 12 weeks is best time to do that. And then slow reintroduction, where you reintroduce each particular set of products every 5 to 7 days to allow for that sensitivity reaction to develop. If a person were to develop it, you want to know that. And that's why you don't want to go and eat pizza with multiple different allergens or antigens that can create sensitivity or allergy reaction. There are lots of testing available, and Cyrex that checks 86 different foods, all tests, 184 foods, comprehensive panel for IgG, IgA, and additives. Genova has 90 IgGs and 19 IgEs. The pricing here was from a couple of years ago. It's probably more expensive now. I didn't check, honestly. So instead of doing elimination diet, yes, you can do this type of testing, but elimination diet has some values as well, because it's all of this testing done in vitro, and the elimination diet is technically in vivo. I do want to point out there is this allergytest.co. It has hair analysis, which bioresonance test, and at this point, it's more than 900 different things that they test for. And it's surprisingly quite accurate. And it's not per se allergy test or sensitivity test, but whatever is this bioresonance technology is, it works quite accurately. So as there are some root causes for immune disbalances, and guess what? They're exactly the same ones as for everything else we talked about before. Leaky guts, infections, Lyme, Epstein-Barr virus, COVID virus can trigger immune disbalance. High stress, we definitely, if we are stressed, we are more likely to catch common cold. Sleep issues, people, we talked about sleep last week or a couple of weeks ago, and I shared the information that people who don't sleep, who skip on sleep for a couple of days, their immune system goes down, and again, they are more likely to develop upper respiratory infection and other maladies. Hormonal disbalances, for example, when women become pregnant, a lot of their autoimmune conditions get better, and when their pregnancy ends, they frequently will have flare-up of autoimmunities. Those things are known for years and years. So hormones play a big role. Toxins. I've been learning a lot more about mycotoxins, and I see how it affects the immune system directly and indirectly. Heavy metals, they're just pegs in a machinery. They don't allow machinery to work well, and because of that have to be eliminated. And so technically, to improve your immune system, you want to work on all of those above. And we talk about them separately, and therefore I'm not going to talk much about here. So as a summary, immune system is complex. Dysfunction of immune system is associated with multiple chronic and acute conditions, and we need to deal with root causes to improve immune system.